Hello, everyone. I'm Solome Tibabu, host for the Going Digital Behavioral Health Tech Conference. And today I'm super excited to have Rick Abbott and Erica Murdock, co-founders of Lynn Health. To get started, Rick, how about you tell us a little bit more about what is Lynn Health to get started?
Absolutely. Really excited to be here and to share the story of how Eric and I have brought Lynn to life. Lynn Health is a digital clinic that delivers multidisciplinary care for those that are considered polychronic. The clinical condition polychronic essentially means you're carrying two or more concurrent medical or mental health related conditions. Lynn is the product of a number of experiences, both on the professional side and the personal side for me. So professionally, in my prior role at a large health plan, we were able to offer solutions, particularly from a digital perspective, for a number of different conditions, so long as they were specific to that condition. So we had a diabetes solution, we had a mental health solution, we had an MSK solution. But the minute a member had two or more conditions, our ability to support them completely fell apart. And that is where I realized we needed something different, something in the market that would be focused specifically to the unique needs of those carrying multiple chronic conditions, which in a post-COVID world is far more likely than it's ever been in recent memory. Personally, though, I have someone in my life who is polychronic. And even with all of the access and the network and the resources I had available, it was still a miserable experience to be able to support her. This company is named after her. Her middle name is Lynn. So again, this is something I believe is relevant in the market, but also has a very, very personal meaning for me.
That's so great. I can't wait to ask a little bit more. But right off the bat, you mentioned this idea of a lot of healthcare companies only focusing on one chronic condition at a time. Maybe, Erica, if you could tell me a little bit more about what makes your care model different, this polychronic condition piece.
Yeah, so first of all, thank you for having us. I'm really excited to share more about Lynn today. So just to kind of level set on what makes us different, I think Rick hit on it. It's that we are focused specifically on the polychronic population. Having built our solution to focus on those people, we really are addressing their unique needs and making sure we're getting in front of them and supporting them wherever they are in their journey. We know that many people will come to us balancing a number of different providers, a number of different solutions that are offered through their employer. And we want to insert ourselves in a way that's seamless and really supports them through advocacy, navigation, coordination, and even offering them care through our multidisciplinary care team. And so unlike a lot of other solutions on the market, with that focus in mind, what we hope to do is alleviate some of those additional solutions that they're using and aggregate them in a way that makes it more natural for them to consume healthcare.
So this is the Going Digital Behavioral Health Tech Summit. So I might ask you more specifically about one of those conditions. How do you address behavioral health in the context of other multiple chronic conditions?
Yeah. So one of the things we have found from our first set of patients, and I think is intuitive based upon just, for instance, the past 24 months, is that if you are carrying one chronic condition on the medical side, something like diabetes or a musculoskeletal related issue, the likelihood that you have something like anxiety or depression or substance use disorder is disproportionately higher than the traditional population who might not be managing any conditions. And I think one of the things that we knew right away was because of stigma and because of a lack of resources and a lack of network options, many people do not address the behavioral health needs that they have. And that exacerbates all of the other conditions that they are carrying. So one of the things we wanted to really focus on and put at the center of our model is being able to support the critical behavioral health needs of our patients. And as part of that multidisciplinary model, we do staff behavioral health practitioners who do a couple of different things. So first, they inform how we're going to support that behavioral health care within the context of the overall clinical care plan that we're delivering on an individualized basis for those patients. Secondly, they actually can deliver clinical care. So if you need to speak to a behavioral health practitioner in the current market, it can take 4 to 6 weeks to find someone who's in network, who has the availability to take you. And if they are not in network, for instance, you're probably going to have to pay on a self-pay basis, which is financially debilitating for some people. Our model is set up to actually make that part of the care model, to make sure you have access to that care instantaneously and to really understand your specific needs. And then the third piece is many people need to get on the right prescription regimen to be able to manage those conditions. And the behavioral health practitioner works collaboratively with our pharmacist to make sure that you're on the right medications, they are specific to your individual needs, and they are rationalized within the context of the totality of the actual care plan that you have. So we viewed it as a critical enabler to being able to deliver whole person care. And our first set of patients have proven that was the right decision.
Wow. Yeah, that definitely seems very holistic. You're attacking the issues at various angles. And I guess in the context of the digital health landscape, would you say you're more of a platform, a navigator, in between?
All right, so happy to take that one. I would say that we consider ourselves essentially a digital health clinic, as Rick mentioned. We really do focus on care delivery. So we bring our multidisciplinary care circle to the forefront of every member's experience. So anyone coming into our program will meet their care partner. They'll have the opportunity to connect with any of the other clinicians in the team as they need. And through that, we enable them with the app or the mobile device or mobile website that we provide for them to access us. So some members will want to pick up the phone, some will want to text, some will require video visits, and we're able to accommodate all of that. Again, meeting members where they are, understanding what is going to suit their unique needs, and being able to set ourselves up accordingly really is something that we're proud of, and we're excited to allow our clinicians to use those tools to their advantage as well.
Yeah, Erica, you mentioned meeting members where they are. I guess when folks ask you what is the specific value that Lynn Health is providing, what are the things they're saying? Is it member satisfaction, cost savings? What makes partners say, yes, we want to partner with you?
Yes. So it's all of that. Every client will come to us for a different reason. Some people will be looking for that member experience up front. And for us, certainly leading with love, empathy, and compassion is at the forefront of everything we do. So we want to deliver that experience, not just for our members, but also provide that space for our providers as well. So as we think of onboarding people and really listening to them and understanding what they need from us, we're able to provide that in a way that they have not had before through their healthcare experience. On the savings side, we know that we're able to get members in, we're able to tackle med management, we're able to support them through finding high quality, low cost specialists, and really focusing on what's going to get them the best care, the right care at the right time. And through that, we know we'll be able to drive savings by getting people on the right track. So on the other side of that, driving outcomes, just really making sure people are doing what they need, closing gaps in care, which aren't terms that we would use with the member necessarily, but are certainly things that are top of mind for our providers. So they're able to address those things to help our members have a great experience and then make the most out of it financially on the other side as well.
Mm-hmm. And you're partnering with health plans and employers specifically. Is there anything that you'd say is value add in terms of what they don't already have internally with their own care management teams?
Absolutely. And so what we see on the health plan side is that so many programs that are employer sponsored carve out a subset of their population that are eligible for their care and case management programs. With Lynn, anyone with 2+ chronic conditions can come into our program. So we don't have that limitation. In that regard, we are able to essentially complement their existing care management, case management programs that are offered through the health plan and offer it to a broader part of the population. So not only are we focusing on the more complex people, the ones that are driving those high costs, but also the ones who are maybe early on in their journey, and we can set them on a right path to not become high cost claimants down the road.
Yeah, I'd like to build upon that. There actually are two different things I'd like to highlight that make us a little bit different than some of the other entities. So one, we actually submit our fees through claims. And the claim is a value-based agreement that we have with the health plan, either on behalf of them or the employers they support. And it covers a substantial portion of the care we provide. So we are not a fee-for-service clinic charging for everything we do. We actually, in a value-based manner, give unlimited access to our members. So for instance, if you have behavioral health needs that require daily support, we are not charging every single day to your employer or health plan for that support. It's actually bundled in that claim. And you can utilize us via phone, text, video, or chat as much as you need. And we think that's critically important because some people do need more intensive care management services than, for instance, a health plan or even another clinic could provide. The second thing I would highlight, though, is we are not abrasive or aggressive with existing health systems. We actually think they have a really strong part in the care we're delivering holistically. There are some things, as great as digital care is, that we're going to need partners to be able to support. Specialty care, surgeries. People are going to sometimes want an in-person visit with a behavioral health practitioner like a psychiatrist. They may need labs. They may need MRIs. We actually seek to get people to the right place, regardless of whether we can deliver all of that care. And I think what that's shown, both from the clients that we've acquired and the partnerships that we've inked with health systems, is that they view that as a critical differentiator for them as well. We become an extension of what they do. They become an extension of what we do. And that allows us to operate more effectively on behalf of the patient instead of competing for the volume of the patients we serve.
Mm-hmm. Yeah, everything you're saying is, I believe, the future of healthcare. Mental health and physical health is, we've been talking about integrated care for a long time, but really a more seamless experience to address all levels, everything that the patient needs at that time, meeting them where they're at. You're really hitting on all of these things. So we've got a lot of health plans, employers in the audience today. Maybe you could help us understand, like, let's say you get a contract signed with them. What's the next step? How do you identify which members will be involved in getting them enrolled? All of that.
Yeah, so as part of our implementation process, we actually request that our clients provide us with historical claims data that will represent their population. So what we do is we pass that on to our data science team who takes a look at it. They essentially run our algorithm to identify that targeted population and identify what the opportunity is to actually support that client's population. Once we identify that group, we're able to risk stratify, get a sense of complexity, the number of conditions they're carrying, whether or not they have a PCP assigned. And we use that to essentially feed into our onboarding process, which is a combination of our operations and our care circle. And so through those processes, we identify people, we partner with the client on communications and how we're going to engage. Some of those engagements will be through education and allowing people to raise their hands. Other will be through care management programs or teams that are able to help us access people who we know are complex and need our help right away. And so we reach out, we connect with them, we talk about our program. They are each assigned a unique care partner who is wholly focused on them. So that person will guide and navigate their relationship with Lynn and any of their other existing providers. So over the course of onboarding, as we get to know people and understand their conditions, we work on goal setting and really do focus on understanding where they are in their journey, what their goals are, and how we can help them achieve them. And so through that process, along with obviously all the data in the background that supports that, we're really creating a holistic view of that person that allows us to deliver the high quality care that our care circle can provide.
Mm-hmm. So I have to ask, how are patients responding?
So patients love it. So if you recall, we went through our pilot earlier this year, kicked off at the end of 2021 and ran through the beginning of this year. And through that, we had such great feedback from people wanting to engage, wanting to continue the program. The satisfaction was off the charts, just for people having their interaction, not only with their care partner, but also with the other clinicians on staff. We had many people ask if they could continue to work with us. Our people were able to help them find care. They were able to listen to them. They were able to help them find resources in their community that might benefit them outside of their clinical care, and really showing the value from a qualitative perspective, and understanding what people are looking for, what they're not getting in their existing healthcare experience. It's clear that we landed the plane pretty well on that, and we're able to really capture what people were looking for. The next phase of Lynn, as we look to engage our patients through our clients, is really focusing on being able to deliver that additional value with the actual clinical care. So bolting on that additional piece that will then further complement the care they're already receiving. But we're pretty stoked to be able to continue that. Our care circle, again, having those interactions with people, the care partners on the front line, the physician, the nurse, the pharmacist, all really taking advantage of those relationships to even take what we learned early on in that pilot and build better as we get working on how we improve upon our platform going forward.
Yeah, and I'll build upon that a little bit as well. So from a quantitative perspective, we did survey all the patients that we had as part of that pilot, and about 85% of them did actually complete that survey. And our CSAT came back at 95%, and our NPS came above 70. Two measures that we are very, very excited about. But some of the actual qualitative feedback and the verbatim comments we received were both heartbreaking and inspirational. There's one patient who comes to mind who just 1 week before enrolled in Lynn had their primary care physician move and their behavioral health practitioner actively offboard them because that practitioner said they could not work with them anymore. And this person told us, had you not come at that particular moment, I don't know what decisions I might have made. And to hear someone say something like that, particularly from a behavioral health perspective, and to know that you were able for the period that we were managing them, 90 days, to help them get on the right track, help them take more control over their healthcare, both medical and mental health related, and then successfully place them at the end of that pilot with a new primary care doc and a behavioral health practitioner who's committed to helping was pretty amazing. So again, it just shows, to your point, that we need to be able to support both of the needs, but this population particularly has such a complex set of conditions and an overwhelming amount of burden that they have to support. A company like Lynn is here just to help and be able to unburden them from that.
Wow, that's excellent. Really meaningful. Speaking of surveys, I might ask you a little bit about something that's on the top of minds of a lot of payers, and that is outcomes. How are you measuring outcomes? What can you tell us about Lynn Health outcomes?
Yeah. So we look at it from a couple different perspectives. So our first goal, obviously, is to deliver a premium experience. And I think our CSAT and our NPS has shown that we have built a structure that allows us to do that. And frankly, it's not like this huge tech structure. Yes, technology enablement is important, but it's the humans behind that technology that are delivering loving and empathetic and compassionate care that really help us hit those goals. Obviously, though, employers and health plans do want to see that quality is improved and that the total cost of care is going down. And some of the attributes that we report out include, for instance, are we keeping people out of places like the ER and the inpatient setting when we might be able to deploy virtual and digital care more effectively to solve their needs, both one, more instantaneously, and two, at a much lower cost than those settings. Second, are making sure that people are on the right prescriptions. So one, as I talked about earlier, some people are not even getting the prescriptions that they need to be able to manage their conditions, particularly from a behavioral health perspective. So helping them get that access is critically important. But then making sure the entirety of their regimen based upon their clinical need is rationalized is also very important. We think that can help drive savings and improve the quality. And then three, we do have a data science team that has actually looked at the entire country and said, who are the highest, for instance, quality orthopedists, cardiologists, et cetera, at both the system level and the individual physician level. And when we need to use specialty care, how do we make sure people get there? That's another way that we're able to improve quality, but it also lowers costs. Sometimes the same procedure can cost 3 to 4 times difference, depending on where you go, and it can be just 1 mile away. And then the last piece is just making sure people have a care plan that's individualized, but also customized based upon personal motivations. So yes, from a claims data perspective, we can know that someone has diabetes, MSK, perhaps anxiety, and some other potentially unmanaged condition. But we might not know that they have food insecurity. We might not know that they're personally motivated to see their children around the holidays and be more mobile, or they may have short-term fitness goals that they want to accomplish. And really integrating those into our care plan not only improves the actual experience for that member, but I truly believe helps us drive down costs and improve quality. People are going to feel more engaged in a care plan that they think they've actively participated in building. So I think all of those measures from an outcomes perspective are important. Some of them are clearly quantifiable based upon published literature. Others are more qualitative based upon how we work with our patients, but we think both are important.
I love that. And Rick, you touched on something really important that I've been thinking a lot about, which is, on one hand, how do you have the ability to deliver the high touch nature of what quality, empathy, and care, and you two even have said love, but at the same time, how can we leverage the power of technology and the benefits with that, scalability, insights that can come from data? So I like to ask everyone, tech versus touch, how do you know how much of each is enough?
Right. So in our model, we use tech to enable the touch. So we think it's critically important to, one, for instance, understand someone from a data perspective. What are the things they're managing clinically? What do we know about them from the longitudinal data that we've gathered? And how can we use that to better inform their care plan? I also talked about how we were able to use it to glean where we should send people. Should they need brick and mortar care and specialty care? And obviously our platform is enabled to allow phone, text, video, chat. So it really allows the member to choose. Do I want to speak to someone on a Zoom call? Would I prefer a phone call, or is text just fine and more convenient for my life? So we're using technology to both understand our patients and build the experience around them. But we think it's also critically important that they know a human is going to respond. That's not to say there are not times where machine learning or AI are important. Behavioral health, for instance, some people are more comfortable sharing very deep personal information with a bot because they don't fear the judgment of a human. But we also think they want to know that there's someone behind the scenes who is going to actively take ownership of managing the conditions I have, delivering the care that I need, and making sure that I feel supported. So again, we use technology really critically to make sure that the experience is built really well around the member, but we think there's a huge human component, particularly from a behavioral health perspective, to being able to make sure that people feel supported. And that's how we've approached it.
And I'll add on to that just a bit. On the flip side are the providers who are actually delivering the care. And so making sure that the tools that we are providing to them are provider influenced, so they have a role in helping us build and develop those. We know that they come to us from all sorts of different companies, whether digital or brick and mortar, and that they've all probably had very frustrating experiences with the technology that's available to them to deliver care. And so we want to take their feedback in as they're going through this experience as well and improve upon our products so that they actually want to work here, want to be part of Lynn, and then can work at the top of their licenses, which is really to provide that high quality care to members.
So I wish we had more time, as always, but I'm going to have to jump into parting thoughts. So anything we didn't cover, or if you could tell us a little bit about how our audience can get involved or support your mission at Lynn Health?
So in terms of who we work with, we do work with commercial entities like employers and health plans, but the number one advocate for who can influence them to work with us is the actual member or the employee of that particular health plan or employer. So by making your employer health plan understand these are services that I think are relevant to me, that could improve the quality of life that I have, can improve the quality of care I receive, and ultimately allow me to interact with the healthcare system more effectively, that is the most impactful thing and way you can actually work with Lynn. Over time, we are moving state by state to be able to make our services available on a direct-to-consumer basis as well. So I think down the road, you might also be able to just frankly raise your hand or reach out directly to us without having to go through an employer health plan. So our hope is that'll be true over time. In terms of parting thoughts, I think one of the things we have found over the past 2 years, I think people have become far more attuned to the behavioral health and mental health needs of their employees and their members. But I still think we have a long way to go. I think people view it in isolation as a service you receive, for instance, to treat your anxiety or to treat your depression, but understanding that it might actually be completely involved with some of the medical care you receive or the social services support that you're not receiving, et cetera. I think that's very, very important. Still something not everyone's come to understand. I think we are focused again on whole person care, understanding the mental health needs of our patients within the context of who they are and the clinical conditions they have, and being able to provide solutions that are built around them are very, very important. So that's just what I'd highlight. I think we have to continue to make sure that people feel that there's no stigma associated with these conditions, that they should seek access to this care, and that it's a critical component of whole person care. That's one of the goals I have for 2022 and beyond.
Well, thank you both so much. This was really wonderful to learn more about the impact you're making at Lynn Health, and I'm confident that that will continue to grow. So thanks for sharing all these great insights today with us.
Thank you for having us.
Thank you.